Hello healers, my name is Ben and this is the Mosh Report. I'm here today in the town of Bad Aibling, Germany at the Klinik St. Georg. Klinik St. Georg is probably the most well-known cancer clinic and health clinic in the world of integrative care in Germany. It has been around for quite some time. And some of the backstory about this clinic includes the previous leadership was a Dr. Douwes, who unfortunately has passed. His wife is now the upper management, and the clinic medical director is Dr. Friedrich Migeod, whom we have the pleasure of meeting with today. So, as part of our cancer clinic tours, we are going to be speaking with Dr. Migeod and learning a little bit more about Klinik St. Georg. Dr. Migeod, thank you again for welcoming us to Klinik St. Georg. I'd like to share with our audience a little bit of your own personal history as well as the history of the clinic.
Yeah.
Can we start by just talking a little bit about your own history in integrative oncology and medicine in general?
Yeah, thank you very much for coming. I know you've been coming a long way, and I'm happy to welcome you both here in St. George Hospital. About my own history, let's say I'm the third time in this hospital. I've been here first time 1992. Now I'm again here since about 5 years. I've been educated as an internal medicine with oncology in the 80s and 90s, but I found out that the results were not so promising. So I was trying to integrate integrative oncology, and I've been working in several hospitals. And the longest time in this hospital now for 5 years, that's as I said.
So general medicine as well as oncology?
Let's say internal medicine and oncology.
I see.
As well as complementary oncology. These are my main points.
In some ways, I think integrative medicine has become part of the way that oncology is practiced generally in Germany, and in the United States, it's only slowly being adopted. So in integrative medicine, there are some things that we already sort of understand as becoming practiced more often. But every clinic has some quality or characteristic that makes their treatment a little different. Is there something about your treatment that you feel maybe is unique to you or is different from how other people approach the same subject?
Oh yes, I think, let's say in complementary oncology, it's been long known, for example, in pancreatic carcinoma, that hyperthermia is a topic, that hyperthermia is able to improve the results. And so in this hospital, hyperthermia is being done in several ways. We will see later. Now what I like to see is that the guideline oncology also is coming to this topic and has found out, hyperthermia with chemotherapy is more effective than chemotherapy alone. So many results which have been known for a long time in complementary oncology now are being more and more adapted by the normal oncology, so to say. I don't refuse the normal oncology, but sometimes the normal oncology is just too hard. There's too many side effects for patients. So that's another topic, important topic. The oncology has found out that's very important to preserve the quality of life. For example, the body weight, or to reduce the pain. And when you get these topics being treated, then you have much better results than only giving chemotherapy all the time.
Mm-hmm.
That's also what now the normal oncology more and more has learned, that the quality of life is also very important topic.
Mm-hmm. This sounds like you talking about personalized medicine.
Yeah, that's right. That's how to say the correct name, no? Personalized medicine.
Can you tell us a little bit about the history of Klinik St. George?
Yeah.
I know it's a long history. We don't need the long version.
No. I just tell you, it's an old building with many new things in. The old building is because about 400 or 500 years ago, there had been monks here. Mm-hmm. Then, since about 200 years, it had been a hotel, a huge hotel. And since about now, more than 30 years, it's a hospital, St. George, which was founded by Dr. Douwes, who has passed away last year, but the family Douwes still is in here, administration and in some parts. Yeah. And this hospital has now, so to say, three main three fields. It's not only the integrative oncology. The second big field is the Lyme disease. So many patients from the eastern coast of the US, from Australia, from other parts, are coming for treatment of the Lyme disease. And since about half a year, the third field who we do have are the people who have been damaged by COVID or by COVID injections, vaccines, yeah?
Yeah.
And that's how to say,
critical topic.
A hot topic, yeah, thank you. But we've got a specialist here, and there are people, for example, who are not able to breathe properly, who've got paralysis, and they are being treated by a certain kind of, we will see later, certain kind of dialysis. Mm-hmm. The blood is being removed, filtered, all the COVID spikes are being filtered out, and then they are given back to the body. So these are the three topics in hospitals in Georgia now.
Okay, well, again, I'm very curious, and I want to keep asking you questions, but I will be respectful of your time, as well as I know that you'd like to show us the clinic. So why don't we go ahead and start on the tour, and I'll try to restrain my curiosity, and I'll just let you speak and tell us what you feel is important for us to know.
Okay, yeah, I'm happy to show you a little bit around. Here we are in the third floor, in the top floor, and here we've got the clinic, where the patients from abroad, from outside are coming in, getting infusions. Now we'll go this way. On the left side, all the doctors' rooms are, and for example, next door, urologist. At the end, there's a room of Dr. Hudi doing the hormonal checks and hormonal treatments. Now we go this way, and here we've got ultrasound room where removal of fluids is being done, for example, from the lungs. And here in this room, we do have the infusions. We see patient.
Maybe go
Let me have it. Here, infusions are being done, and blood taken, and so on. Yeah. Now we go this way again. Yeah. Here we've got the waiting room for the patient coming from outside, and here are the nurses where they can tell them that they are here. Mm-hmm. Yeah. We can have a look into the room of Dr. Douwes. Hopefully. Yeah. This has been the room of Dr. Douwes. Now we have arranged it a little bit, but here was the room of Dr. Douwes for maybe 30 years. Yeah. And we just go this way, because here we are in the lab. Hallo, guten Tag. Sie werden das gefilmt. Hello. Morning. These ladies are, I think, from South Africa.
Yes.
Working on the COVID infection topic.
I see.
We've got a special lab here, and they are checking the blood. Here we've got the normal blood. Part of the blood is being sent away. Part of the blood is being made here. For example, here we've got the blood count. So the white cells are checked in the red blood and the platelets. And potassium, sodium, sugar, whatever we need. Okay, thank you. Now we go this way back. Please don't suffer. So many boxes and kidneys around. This is Dr. Holzhauer.
Hello.
Nice meeting you. Hello. Nice meeting you.
Nice to meet you.
Ja, super. Schön.
Okay, now we go downstairs.
Right.
We also do have a dermatologist, which is the daughter of Dr. Douwes. You see her name, Katrin Douwes. She's working as well here.
And Renata is a mother.
Yeah, we will meet her in some minutes.
Very good.
Now we just go down by the stairs. Here we've got another ultrasound room, but we don't. ECG is being done, lung function, and yeah. Now we go.
We can see some of the older architecture.
Yeah,
still.
this is a very old. How do you call this? Woods. Yeah. And we just go down here.
Well,
Here you see Dr. Douwes and his wife. This was a painting by a patient, a thankful patient. He said, I don't want to give you money or a red wine or something, I will paint you. But I'm not sure whether his wife likes this picture so very much. That's why they said, okay, let's put it there.
I think it is very nice.
From me?
I think it looks good.
Yeah, it's quite nice. Here construction works are going on, because this second floor will be a where patients will be having oncological diseases.
Okay.
So all the rooms are being reconstructed now.
Okay, and when do you anticipate completion of this part of
I
the
think
clinic?
in about 2 months. They are really have progressed well, and about 20 years ago there already had been a ward for patients, but now we still have other wards where the patients are located. We will see them. Now here we've got the endoscopy. Upper endoscopy, colonoscopy, bronchoscopy is being done by a specialist, Dr. Helt. Here he's got a huge department, and the patients sitting over there are waiting for the endoscopy.
I see.
Here in this room, the plasmapheresis of the COVID patients are being done.
Okay.
Now there are sitting 5 patients, so we cannot enter. But they're sitting in chairs, and it takes its time, about 4 hours.
Are there procedures related to oncology that plasmapheresis is used?
Sometimes it's also used in oncology when you find many circulating tumor cells in the blood.
Okay.
Now first we go this way, and then we go to the ward.
Okay.
Here's the administration area as well as the hyperthermia area. We will have a look. Here are the ladies where the patient comes in and says hello.
And do you help with the submission and paperwork for insurance for people traveling?
Yeah, that's important. When the patient leaves, he gets a bill, so to say, with numbers, and we've got and Friedrich is helping to transfer the bill numbers into the American ones, for example. So they get refunded at least more than 50% at home.
Very good.
Here you see Dr. Douwes again.
Yes.
And now we go to the hyperthermia department, afterwards to the administration.
So, in addition to solid tumors, you treat lymphomas
Yes.
and some types of leukemia, or no?
The chronic ones, yes.
Okay, good to know.
Yeah.
So before people would make arrangements, they would need to call and make sure that whatever they're dealing with, that you would be addressing it.
Because the acute leukemias, you need how do you call this? Blood support. You have to do transfusions and transfusion of platelets, of red blood, of white cells, and so it's a blood deposit. Here also the prostate treatments are being done in prostate cancer, not in benign hyperplasia, and let's say about 3 or 4 years ago we've done the hyperthermia of the prostate. But
Localized?
Localized. It's been done by a catheter put in. But now we have changed. We are doing so-called laser therapy. So-called
Like ablation?
no. It's a photodynamic infusion is being given. The photodynamic drug, which is called chlorine, is accumulating in the cancer cells. Then a little laser is being put through the catheter into the prostate, and then by this laser light and the photodynamic drug, the cancer cells are being destroyed. Patient doesn't feel very much, but it's quite effective. Let me have a look whether we can have a look in here. No, unfortunately, no. Both, no, we cannot do it.
Well, it's good that the clinic is busy.
Oh, yeah, it's
have plenty of patients.
And tomorrow's a holiday. Yeah, it's called Allerseelen. Means
All Saints.
yeah. Also, what is being done here is in bladder cancer. When there's somebody who doesn't want to get operated on this bladder cancer, then you can do hyperthermic perfusion of the bladder cancer. That's where we find the local hyperthermia. There. Now we go next door where we find the local hyperthermia. You see, it's very crowded because there are many works going on. And here we've got the local hyperthermia department. Let me have a look. Yeah, you can come in. Yes, you can come in. This room is occupied, but here you see the local machine, which is called the Oncotherm. I think it's quite well known. And the local hyperthermia is being done by putting a plate, for example, onto the liver where we have metastasis. Below here you find a counterplate, and the machine is sending from through this plate so-called electromagnetic waves, which are like in the microwave in the kitchen, which are being turned into heat in the metastasis. Patient normally doesn't feel very much. Some are also disappointed and say, "Oh, it doesn't get hot." So I say it's not infrared lamp. It's waves you normally don't feel. But when we've got a mobile phoning long time, your ear is getting very hot. That's also hyperthermia because the waves, the cartilage is not able to to get the heat away. So this is, so to say, the effect of the local hypothermia, and we're trying to achieve temperatures above 105 Fahrenheit. It's been done 60 minutes and can be repeated several times a week, whereas the whole body hypothermia only can be done once a week. On the third floor where we started, there are mainly outpatient patients, so to say, but patient coming from far away normally are asking to be located in the hospital, right? And we've got, I think, 45 rooms where they can stay either alone or with their relatives, with 2 people. And also we've got a kitchen here in this hospital we'll see later. Now we go this way. Here's a waiting room for the endoscopy. Now we go this way. That's an oxygen chamber, hyperbaric oxygen chamber for people having breathing problems, people having brain problems.
Is there a light coming inside? I mean, this is...
Let me have a look. I think you want to start the alarm. Okay. So this is for 4 places. This is hyperbaric chamber. People are sitting about 2 hours in here. This is being done with when people have a low oxygen supply in their body, either lungs or brain. Now we go this way. No, I don't show you all the hospital, but I can show you where the nurse's room is. Now this is one ward. We've got 5 stories, yeah? And this is number 1. Here, the so-called patients who have had the extreme whole body hypothermia are being located because after the whole body hypothermia, they need intensive aftercare for 4 or 5 hours, like blood pressure, pulse, temperature, and so on. And that's why they are here in this.
All right, so this is a typical patient room.
2 beds, and here you can enter the garden.
Again, it smells so good and fresh and very nice.
Yeah.
Pleasant.
So they've got a special type of water here. It's from a valley with water, so to say. And in case a couple is coming, one can stay as a patient, the other one can stay as a relative in this room. Yeah, here we are in the new built physiotherapy department, which had been on the 2nd floor. Now it's here in the ground floor. It's quite new. You get the foot bath, the microwave, the massage, lymph drainage, so everything you need for physiotherapy. Also here is the place where we've got a gentleman who, what do you call this, nutrition, who talks about how to eat, having cancer disease, and he has got his room. Now let's come in here. Here's the infusion room. That's our 2nd one. The infusion room, when people need antibodies or chemotherapy, because also in this department we've got another oncologist, and we've got several possibilities to give infusions. So this was the previous entrance. You know, they came in with the cars and horses, and I remember. Here was an old restaurant. Here was where they put the horses in 200 years ago. These are all things from Dr. Douwes. He has received in his life. For example, there's one from Dean Center for Tick-Borne Illness. in Harvard Medical School. He had lessons there because of his invention of treating Lyme disease. Here's the kitchen. So it's not very tidy at the moment. Now we go to the dining hall. Here's the reception where the patient, the new one, we've got a better one, but this is, so to say, a preliminary one because of the works. This was the dining hall of the old monks, that's why there are arches like this. And Dr. Douwes said, okay, let's preserve the arches. And now we go to the chapel on the back side. This was a wall. This was closed, and he found out there is something hollow behind. This was about 30 years ago, and then he opened and then found a little room. And oh yeah, we can go in there. Just wanted to show you the mud bath. Oh, I hope it's still there. Yeah, it's still there. Of course, now this is like a chapel, but these walls, this on the backside and here, this, and there was another, wall from wood. The many people were sitting in there, maybe 5 people, getting mud. And there was a worker putting the mud in. It was warm, and they had the mud bath. You still see, when you have a look here, this little, how do you call this?
Yeah, a recess.
Recess. There it's where they put the wood in. When the wood planks were like this, then they put all the mud in. People were sitting in for many hours. And later they said, okay, let's rebuild it into a chapel. So,
Dr. Migeod, you're not trying to bring back the mud therapy?
No, because the problem is mud has got less and less. Now they have a shortage of the mud.
Oh.
And they said, no, we have to stop getting mud. Now they have artificial mud, which is
not as good.
Not as good, but because the moors were getting down more, and they want to preserve all the flowers and the animals there. It's about 10 kilometers away from here. I still have, I was there once, and you have to watch a little bit. So you watch your way, because right side, left side, there's the moor. So when you're
quicksand.
Yeah, when you fall in.
Goodbye.
Yeah.
The following segment is an edited version of the full clinic conversation, available at themossreport.com.
Hi.
Hi, Ralph. Nice to see you. I think we've met last time in Bad Aibling, was it?
I believe so,
Yeah,
yes.
A couple of years ago. I think 6 or 7 years ago.
Oh, time flies.
Yeah. And I remember
Right.
we've met there, and as far as I remember, your wife had been with you. Yeah.
Right.
Yeah.
Many times, actually.
Yeah.
So we go back many years. What are the methods that you're using at St. George in terms of complementary cancer treatment?
One of the main topics still is the hyperthermia, which is combined mainly with chemotherapy, if it makes sense. But then chemotherapy is used only in a reduced dose, maybe 50% or 30%, and also is used in a so-called insulin potentiated way. That means you're lowering the blood sugar, and hopefully when the blood sugar is low, the intake into the tumors is much higher. And afterwards, when the 30 or 50% of the chemotherapy is in the tumor lumps or metastasis, then hyperthermia comes and is enhancing the dose even more. And this is one topic. The other one is the many immunotherapies, and we do have the so-called PD-AL1 blockers, which is, so to say, trying to explain the patient. You only can explain that the cancer has found the stopping knob in the immune system, and by these infusions, you're able to deblock this immune blockage. And but also there are complementary immunotherapies when you find a bad immune function by quality or by amount of the cancer fighting cells, and you're able to stimulate it by, for example, mistletoe. There you have special tests to find out which of the mistletoe is the right one. This is sometimes not so very easy, but it's possible. And many patients also are coming because they know after the first cancer treatment, there's still a remaining risk left. And they want to lower the risk. The risk you can measure by testing the circulating cells in the blood, or you can test them by also in the blood by the so-called oncogenes. And normally the normal oncology normally has no answer for this. But what you can do, for example, you can recommend so-called enzymes, which are preventing these circulating tumor cells settling down somewhere as metastasis. Also, you can do the high-dose vitamin C, which by the latest scientific works has found to be enhanced by heat, by hyperthermia. So patients who prefer not to have chemotherapy, but hyperthermia, they get high-dose vitamin C according to their tolerance. And then the hormonal therapy is very important. Of course, you've got the normal anti-hormonal drugs like in breast cancer or prostate cancer, but there are many patients who do not want the anti-hormonal therapy because of side effects, like hot flushes or heavy legs, and in these patients there are also holistic possibilities, plant supplements, which can be very efficient. Taking the prostate cancer, for example, we check the prostate cancer promoting hormones which are called estradiol or dihydrotestosterone, and when you find them too high, there are plant supplements by which you are able to suppress these hormones. The same in prostate cancer. In breast cancer, the hormone-dependent breast cancer. We are taking which you also have in the US. It's called DIM3, which D-indole-methane, or here it's called indole-3-carbinol. So many of the patients who do not tolerate of the breast cancer patients who do not tolerate an anti-hormonal treatment, they get, for example, they are taking the indole-3-carbinol instead of letrozole or aromazine. Yeah, I think no, exemestane. And so the holistic field should not be forgotten, and many patients prefer to have a combination of hyperthermia with chemotherapy, and afterward continuation with a holistic treatment. Thank you so much for your time, and I'm so happy I've seen Ralph again after so many years. And
Yes.
I wish you all the best, and let's stay in contact in case you need.
Well, Dr. Migeod, thank you so much for the tour of St. George Clinic.
Yeah.
Very nice to be here with you.
Yeah.
And we appreciate you taking the time out of your busy day to show us around and give us a tour and tell us more about the history and the treatments that are available here. So thank you very much.
Thank you. I hope you've got some impression about this little hospital, but it has a long history and long tradition. So
for now, for the Moss Report, I'm Ben Moss. How are you healing today?